Hey, it's Dr. Day here at Mountain Movement Center. We're going to take you through a sample treatment today of the neck and shoulder. We just want people to see there's just a lot of different versions of chiropractic. Ours is more comprehensive. We're going to take a look at the muscles as well as doing a spinal alignment. A lot of people have misconceptions around chiropractic and what it is and what a chiropractic treatment looks like, especially this more holistic style. So what you'll see me checking after I ask John what's going on is the dynamic motion of every one of the joints of his spine. So this joint's supposed to move, this one, and they all work together in concert with all of these muscle attachments. Every bony area you see that crops out, and even these little ridges, are where muscles meet, and they together create movement and signaling for the rest of your body, for your extremities and all those things. So spinal alignment, spinal movement is really important. Now we go one step farther, and we really feel that muscle alignment attaching into the extremities and the spine all link up together. So we're going to go more in depth and also treat the muscle as well as doing a spinal alignment. So what's bothering you today, bud?
Been experiencing a lot of tightness up in the upper shoulders,
Okay.
neck, kind of a lot of heat, radiant heat in my neck.
Okay.
And then some tightness in the left side of the lower back.
Okay. And when do you feel it most?
Pretty much all the time, to be honest with you.
Okay.
I do a lot of lifting and twisting for my job, so.
And you said some wrist issues as well?
Yes.
Okay.
Yeah.
So if you want to come around the side here, we're going to start with a visual inspection. And what we can see is there's a little too much excessive curvature here, and his head shifts forward of his center of gravity. And he has a job where he has to lean forward a lot. So his spine's taken on too much here, and when we try to, too much flexion or leaning forward, and when we try to get motion heading back, there's rigidity or stuckness. And that's where the spinal joints have gotten so used to being here that now they don't really want to participate and move in the opposite way. Our body adapts to whatever we put it under most. Then we come around, and just on the shadow here, we can see his shoulder blade drifts up higher. This is the bottom of his shoulder blade on the left. This is the one on the right. So we know that the neck issue is as much coming from the shoulder blade muscles and the balance of the shoulder blade. Now, I'll take you through a mini exam. We're going to check his range of motion. And I'm as much palpating as really taking degrees. This side has way more joint play and way more muscle, the ability of the muscles to release. It's still tight here at the levator scapula and trap, but this side, very tight right here. Okay, so this levator scapula muscle comes from the spinal joints and attaches into the scapula. Now we have to ask ourselves, why would this be so excessively tight? Well, if the shoulder blade muscles down lower have become inhibited, if the brain's not sending enough signals here, eventually you'll have to compensate and use this muscle excessively. An overworked muscle gets tight, and eventually the fascia begins to lock up. Now we're just mapping out the joints, and at T1 and the ribs that come in and attach, they form another joint. There's nice joint play, which means that when I go to move these joints, they actually do the motion they're supposed to do for the most part. They have some limitation going back and forth, but on the right, they rotate and bend just fine. But this side, there's limitation in every single one. So I can rotate him really easily this way, and that side, that way is limited. So we're already starting to hone in on the issue. Then we come and check range of motion of the shoulder in different planes. And we can feel a little bit of clicking in there, and right here, very limited, because his job has him holding his body out here a lot. So these muscles need to be used. The brain goes, okay, we gotta lock him down. We gotta compensate for what he has to do 8 hours a day. So we're gonna go in and retrain the nerve signal to those muscles, because until we get this area more released, the shoulder blade isn't gonna sit where it needs to be, and this will forever be an issue. So we're gonna get to the real cause of it. Now let's check upper. You said burning kind of up into here.
Mm-hmm.
And his joint range of motion here is great. what we find, remember we talked about his head being forward of center, is because of the head being forward, he's getting some compression and some tightness in the upper muscles called the suboccipitals. And his motion of his joints move great in his upper neck. This area is very important because the position of our head tells us where we are in equilibrium in space. We see his right shoulder high, so what's happening is as a counter move, he's shifting his head, and so he's tight on the right side more than the left up high. But we're also just gonna do some work in here in the knots, trigger points we call them. Okay, so we have a pretty good game plan. Let's go face down for me and we'll get to work. So this table is a special table and we have some specialized tools. And what we're really trying to do throughout the whole treatment is get new messages to the spinal cord and the brain by way of moving the joints. The joint capsule is filled with nerve endings, and so are the muscles. They have position sensors in them, and if you can release them, you can start to retrain the way that your brain's communicating back and forth. Then there's the cellular component, which is your body when overused enough. So this percussion tool is great for just going in and rebooting some of these knots. It's doing enough percussion that it's creating new blood flow and some neural stimuli where the knot will just turn off. So we're just getting in here and doing a warm-up. How we doing so far?
Doing great.
All right. So this is the scapula, and we're right at the tip of it. It goes like this and comes around the top. The levator scapula inserts at the superior angle. So we're hanging right there because that's where one trigger point loves to hide out. It gives people a lot of neck pain. And we're slowly inching our way up the levator scapula. And we feel that this shoulder is so bunched up, we actually want to let it hang here for a second and also work the muscles that come in to the side of the shoulder blade or the scapula, and those are called the rhomboids. Now there's been some theoretical things of why the rhomboids and levator get tight. One of my favorite theories is Vladimir Yonda. He came out of the theory that the levator scapula is only supposed to fire when needed, when you need to turn your head, when you need to extend your head. When it's asked to do more, when other muscles aren't working, and it becomes where it needs to be firing constantly to support your body, it will tighten up. So it's supposed to fire in phases, and it becomes where it needs to be on all the time. That's when you start to see these patterns. Whereas the muscles in John's lower scapula, they're supposed to be firing all the time. So now we're going to come in and try to let his arm get heavy and his shoulder blade get heavy. The nervous system likes to guard a bit. Once a pattern sets in, it's the practitioner's job to try to find where you can get the body into a state of ease and just get the muscle to turn off. You'll feel the knot just go and let go under your finger. So let's do 10 deep breaths here. And I'm going to take the muscle from its shortened position in this rested, kind of relaxed, and I'm just waiting. Because as he's breathing, his body will start to let go of this spasm, this tightness in this muscle. And then we just slowly lengthen the muscle all the way down. And we hold right on that knot. Very tight area for him. And trigger points are fascinating because they can be giving you headaches, jaw pain, they can refer pain down the arm, and people think that it's a pinched nerve, and a lot of times it's a trigger point. I'll show you on the chart in a minute. So here's the big daddy-o. We're going to move through a range of motion again. And what they find in the research is if you can guide the muscle through its range of motion, you can retrain those little nerve sensors that are deep in the muscle belly. And those nerve sensors communicate to the spinal cord, ultimately up to your cerebellum and even into your processing centers of your cortex. So if you can reboot those, you can reverse injury. Now most chiropractors, typically we would also do some fascial work, because what it feels like right in this zone is the joint or the muscle's taken on some fibrous adhesion, we call it. And that is when a muscle gets so overused that the fascia, the connective tissue that covers it, begins to tighten up too. Now it's like webbing, like spider webbing. So you can guess if it's very dense spider webbing and it starts to tighten up, it will start to limit the motion itself. So you can work all the knots in the world, but if the fascia is limited, so right now we're just doing passes, not super visible, but right down from the mid area of the levator scapula, the scalene, and the trapezius. Right now I'm hitting the posterior scalene, then we're hitting the upper trapezius, and right after that we're hitting the levator scapula. And his levator is definitely one of his prime areas. How we doing on tension? Is that too much pressure?
I'm doing all right.
And then right there, nice, another deep breath. Good. So while we're here, now we're going to check the ribs. And even down here, as I'm moving, the ribs are coming in and they're attaching into the joints of the spine. And the spine itself rotates as well. So let me lay this over real quick. And we're palpating, and we feel that these move just fine, and so do the ribs. This side stops right here. So this is an area you do a mobilization or an adjustment on. A mobilization, for those who aren't super comfortable with an adjustment, is just taking the joint to in range and pulsing. Just like that. Or creating a stretch, and now push your ribs back into me and relax. So these are the different levels that I've kind of adapted and pushed back. And the pushing back and forth allows me to get deeper into that rib stretch. But the adjustment is, we know that these spinal joints look kind of like this. So we come up and we start heading our direction of our force that way and forward. Deep breath and out. And I cross my hands over, and that's the adjustment. We come up higher, still tighter ribs. So really the problem comes all the way to here, and he said his low back hurts there too. Again, most of my pressure, this is just a helper hand, and I'm delivering a force, getting these joints to move. And when you get joints to move, the joint capsule opens for a second, and that's the little noise you hear. It's like a gas pressure release. Deep breath and out. And another great one. Now we come back, and we still have some limitations. So now what we're going to do is use my table here and just do some dynamic motion into the fascia, into the connective tissue. The body loves motion, especially in the way it's designed. So my whole job is to figure out where the patient's not moving properly in comparison to the way their body was designed. If the joints and ribs are rotated higher on this side, that means the whole biomechanics are going to change here. Eventually your brain's going to register pain. That's the only signaler it has to let you know something's wrong, other than loss of function. But we tend to just keep pushing through the loss of function. So pain is our messenger telling us something's up. Okay, so we go back and check. Very equal. One's still a little more restricted here at what we call the first rib. So we're going to come in and take tension on that first rib and counter rotate very gently and drive straight into the joint that the first rib meets the thoracic spine. And that's it. And that one didn't release, so one of my favorite areas to utilize this special tool is the transition area of the neck to the head. And so you can just send a lot of neural stimuli. So it's doing this motion, and that's motion back and forth, especially he was stuck here, and if we do motion pushing it this way, it's going to start retraining the nerve response. Some people, you know, the noise is just a spring loaded, but I've also will do this version, just back and forth, easing his spine, because right here, his upper thoracic spine is where his spine doesn't have good extensibility, and on the left, good rotation. And that let go. Okay, so we got a lot of balance there. Let's go on your back, and we'll do a little sample treatment here. So the face up gets more dynamic. I'm treating the levator scapula. You saw me treating it on the face down version. Now I'm going to lock my hand in and move through the upper portion of this muscle. So this is the shortened position of the muscle. We're just going to hang here until we feel it let go. Deep breath. And rotate. And deep breath. And rotate. Let me know if it's too much. Inhale and exhale. Good. Sometimes we'll only treat in the face up, and I'm going to hook my hands right into the joints and just influence muscle and joint motion. Remember when he was seated, he couldn't move that well going this way. So I'm inching my way up level by level, muscle attachment by muscle attachment, joint by joint, and releasing that area. And right there is where he gets his burning pain, and we find a knot, a pretty sizable series of muscles, most likely some of his splenius muscles. So the adjustment is incredibly useful. As you can see, without that joint motion, the muscles are moving, but the joints still don't have full motion in any direction. But we go one step farther with our team and say, well, but we still need to balance the muscle and find the cause. His cause is as much giving him exercises for his shoulder blade, his lower shoulder blade, his serratus anterior, and his middle and lower trap, and working on the front of this shoulder. So we're gonna do a quick version of the shoulder too. And right here is his pectoralis minor, and that tends to be a tricky one. So what he's gonna do to get this to let go is he's gonna press your whole arm up into me. So straight up, there you go. Deep breath, 5, 4, 3, 2, and let it go. And stop pressing. Good. Now squeeze your shoulder blades together a little bit, just gently. Good. This can be real tender, so let me know. What number are we at out of 10 right now, pain-wise?
1.
Nice.
Feels pretty good.
So we're opening up the pec, and this is the job of the pectoral. Pressing and internal rotation, adduction, but here we're trying to do the opposite of that. We're trying to get its range of motion back because it can really limit his arm bone, his humerus. And most people don't know this, but your shoulder blade wraps around and there's a little nodule right here, the coracoid process. And so right where the coracoid is, if the pec is tight, it's like me hemming his shirt shut. And now that's gonna bring the shoulder blade up and around and the humerus in. Now he can't generate any power through his shoulder blade. We get our power through a spiral muscle firing pattern into his shoulder blade. So he's gonna have more wrist trouble too, because his force should be able to be generated with his shoulder blade here. It's like your second core. And instead, he has to do a lot of work here, which loads up the forearm. So, there we go. We're gonna work that knot, deep breath, and let it go. And this one's a tricky one. So we're gonna get it into its true shortened rested pattern. Deep breath. And now we're gonna try to deep breath again and let it go. Good. And then lastly, we're gonna check the range of motion of his shoulder in every direction. He's a little limited in external rotation. So we just mobilize. It's not really an adjustment, but the joint capsule can get used to him being rotated in. And we'll do this in another video. So one more thing, face down. We're just gonna check our work. And we're gonna do some mobilization on his scapula. So there are lots of nerve sensors, and if you put the scapula back in the right place and just kind of gently nudge it, you can often see some great results. But after the camera shuts off, we're also going to teach him a lot of stretches for his chest muscles and his front of his arm muscles, and we're going to show him activation exercises for the scapular muscles, the middle and lower trapezius, and the serratus anterior, because he's getting a little bit of winging. But we come back and check. Great motion. There's still a bit of work to go, but you gotta kind of know when to say enough's enough on the body. And the last area is C1. So go on your back, we'll get C1. And I want you to watch on the camera, because everyone's so, fascinated by the upper neck adjustment. But the way I do it, there's hardly any rotation. We bring him to in range, and most of the motion is very quick and hardly any, we're not going all the way over here. We're keeping him very tight, very close, and it's just a quick motion. And that was the adjustment. And then on the side that he had burning pain, that was it. And those released, and then we're just gonna stretch. He's always compressed this way, so we're just gonna open up the joints and muscle of his cranial area, his suboccipitals, and I'm tractioning and hooking and creating opening where he's pretty compressed most of the day for work, as chiropractors often are. So basically his treatment is basically what I need after working on people all day. And there you have it. So let's sit up and just check our progress. So we come here, the shoulder dropped significantly. The scapular's still winging, but when we compare their distance, this is still a little higher, but it was up here. So it's dropped down significantly. And when we check the front to back, the rotation is better by about 50 to 60%. So, a series of adjustments. Now we're gonna show him how to mobilize this muscle with 2 tennis balls. Stretch this and activate this. So hope you guys enjoyed it. Any questions about chiropractic or this treatment, you can feel free to make a comment below, or you can go to mountainmovementcenter.com. There's lots of info about our specialty treatments, and we're in Greenville, South Carolina. Thanks.